Hello, good afternoon. Dr. Chudi Fundu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic. Today's event is going to focus on teenage or adolescent pregnancy. What are the 5 factors that can actually cause teenage pregnancy or adolescent pregnancy? So that's a topic of great importance. This is a topic that can affect the whole family. This is a topic that can affect the direct kid involved, the family, the future, and the potential. So please, when you come in, allow me a few minutes so that other people can join and we can have a 30 minutes discussion about this topic. Very, very important. You can ask your questions at the end of my presentation, but please, I want you to take this particular topic very serious because it's currently a problem affecting so many families. Statistically, every single year we have a lot of young girls in this category. So teenage pregnancy is actually defined as any pregnancy before 20 years. So any form of pregnancy in any girl before age 20. So under 20, pregnancy is defined as teenage or adolescent pregnancy. There are so many health hazards involved in this particular issue, so many. In as much as the body of a woman at that age can support pregnancy, it doesn't mean they are well equipped. They are not well matured. They are not experienced. They are not, ready to actually take up the responsibility because pregnancy on itself can change a lot of things. At that particular age below 20 is when they are still trying to adjust, acquire education, get their bearing, and 99% of them are still likely living with their parents before the age 20. So there are so many factors that can cause this. Number one on the list is what? Lack of basic information on reproductive and sexual rights. That's number one cause of teenage pregnancy globally. Now, comparatively, when we look at teenage pregnancy from developing and developed countries, so using developed countries like America and developing countries like Nigeria, when we look at the numbers, for some reasons, there is a big gap. So when you look at the developing countries, they actually start the teachings about sexual and reproductive rights way early. So the possibility that a 15-year-old American girl might know about sexual rights, might know about contraceptives, compared to a 15-year-old in developing country, there are so many gaps. So this is an area we need to fill in the gaps. So number one cause is lack of adequate, basic, rudimentary knowledge about reproductive health, about sexual health, about issues they should know about, like contraceptives. Because at that particular stage, they are very fertile. So any young girl without any problems below 20 can easily become pregnant, even at the slightest chance. So it's important we hone in on education. Very important. Start the education as early as possible, but tailor the message at that particular age. Let me give you an example. Lately, if you pay attention, young girls are starting to have their bleeding for the first time very early. Previously, it used to be around age 11, 12, but lately, a girl of 7, 8, 9, depending on her body makeup, can start bleeding early. Now, at that particular point, you have to emphasize and bring it into her ears exactly what's going on. You don't need to sugarcoat it. You don't need to make it to look desirable. You have to say it the way it is. You have to teach your girls the various reproductive organs. You have to teach your boys the various reproductive organs, how babies are made. what's going to happen when this happens. You have to start early, but you have to tailor the message so they can understand it. So the message you give a 9-year-old girl will not be the same message you give a 12-year-old girl, because there are so many things that happen in between. Bottom line, we have to up our ante in this direction. We are not doing a good job. We have to increase the servicing, the education, the learning process, the education of our young girls about what's going on. The earlier we do this, the better. Number two, inadequate access to services tailored for adolescents. So in most developing countries, they don't really budget more on adolescent health. They are more interested in other things outside health. So when we don't have adequate services that tailor to the adolescent, they will not know, even when they have a need to acquire the services, to have the knowledge. It's not there, so it's practically missing. So this is also a direct cause of teenage pregnancy. So when you tie everything together, you can see a cluster. Now, number three factor, this one is huge, especially in developing countries: family, community, and social pressure to marry early. Marriage is not for kids. Marriage is a very deep commitment. Now, in so many cultures, unfortunately, in developing countries, including Nigeria, the eastern part of Nigeria, and a couple of northern parts, the society, the family, and everybody around these kids that should actually prioritize their education first, drag them into early marriage. Most times for economic reasons. Most times if the family is a very poor family and they don't have the wherewithal, they trade these girls off for little money. So family, community, and social pressure for kids to marry early, it will also be a direct and indirect factor in teenage pregnancy. So we must stop this. We must prioritize things that will benefit our girls and our boys at that particular time. Below 20, they are not ready. That's not the time for becoming pregnant. That's the time for education. Expectedly, a girl at age 20 should have been rounding up with her first degree and getting ready for second degree. It's advisable that all girls should be given adequate education, because education is the light that will give them a lot of opportunities and potentials. So instead of exchanging starting family with education, prioritize the education. Let them get enough education, because the more they get education, the more they are exposed, the more they know their rights, the more they are mature, the more they are ready. Because having a baby is a big responsibility. Having a baby at a teenage age is equivalent to babies having babies. This is why we have a lot of problems. And remember, they have a lot of high potentials of becoming pregnant immediately, because their fertility is very high. So if we don't teach them the right things like contraceptives and being ready and all that, they can actually be pregnant, and they will translate that immaturity to babies. So imagine babies having babies. Very important. So I've mentioned lack of basic knowledge in reproductive and sexual health, inadequate services that tailor to young people, family, community, and societal pressure to marry early. Now, number four factor is really, really bad: sexual violence. There are so many young girls that are sexually abused. Some of them were raped. Some of them were traded for labor and all that. Some families have lost their sense of decency. Some families have used their baby girls to trade for economic gains. Sexual violence is top on the list. And unfortunately, when we talk about sexual violence, it's something that has complexity in the damage it does to the kid involved. Because apart from putting that particular young girl in family way, that young girl is probably going to be prone to sexually transmitted infections, including HPV, which can predispose to cancer. So many of them are, because their pelvic organs are not properly developed, they can have VVF, vesicovaginal fistula, or RVF, retrovaginal fistula, and a couple of other complications, including death. So sexual violence, it's something that can directly lead to this. So we have to start working on this. Now, the number five factor is a subset of this third factor: child early forced marriage. Forced marriage is still out there. It's a big pull that leads to all this teenage pregnancy. And unfortunately, for most teenagers that will be pregnant, they will not seek ANC because sometimes they won't even know they are pregnant. So these are factors we need to focus on and address as a society, and your society starts with your family. So address this at the family level, then address this at the societal level, at the community level. The more we do this, the more we can have hopes. Now, risk factors. Approximately 90% of birth to girls from age 15 to 19 occurs in developing countries. So knowledge, lack of education is directly related to the incidence of all this in early marriage, in girls becoming pregnant early. So we have to increase our access to education. So education is pretty good. Education is the key to so many things. So instead of allowing your girls to veer off, this is the age you encourage them to acquire more education, to know themselves, to develop their talents, to know where they're headed to be themselves, because the more they know, the more they become empowered, the more they can take up the societal challenges because they're going to be exposed. So education is very, very important. One of the studies we had, women and girls that have more education are 5 times more likely to avoid pregnancy. 5 times. So if this girl in her teenage age has education, knows she wants to become this or become that, she will be more aware to do this, except the sexual violence, which they cannot control. So the things they can control, we should allow them to control that, so they will have opportunities to go to school, so they will not have limited potentials and limited future employment and helping themselves to come out from poverty. So these are factors we need to put into consideration regarding reducing the burden of teenage pregnancy. I'm going to open the clinic now, and I'm going to give us an opportunity to ask questions. So please go ahead and ask your questions in real time. Okay, someone is asking how you can book a one-on-one session. Follow the admin. Now, remember, in our community, you have a special opportunity to join the inner caucus of the community. So if you check on the description, you can click on join the community. So there are different perks you can get. There are different criteria. There are different categories you can come in. So if you want to have one-on-one interaction with me on this platform, click on that join button, then they can direct you and you can have access to me. If you're in our Facebook, if you're in our TikTok, if you're in our Instagram, if you're in our Twitter, also follow us. There are so many things you can gain from just following the group. If today is the first day of attending, thank you and welcome. Remember to subscribe. When you subscribe, check your notifications so that anytime I come live, you will have opportunity to join me in real time and get feedback. But right now, please start asking your questions so I can provide you feedbacks. We're going to spend approximately next 10 minutes providing feedbacks. So ask your questions straight on. I'll provide you feedbacks. Okay? Please start asking questions. Everyone. Remember, today we're talking about causes of teenage pregnancy, right? So we tied education, societal pressure, sexual violence, forced marriages, and lack of services that tailor to young people. You just subscribe. It's stated that the site is suspended. I don't understand what you mean by the site is suspended. Please, can you explain better? Which site is suspended? Our YouTube sites? That's not correct. Okay. Admin can help you figure things out. But for now, please keep asking your questions, please. And you can explain better so we can see how we can help you better, okay? But right now, ask me questions related to teenage pregnancy. This is very important. Okay. Are there any pregnancy complications that are commoner in teenage pregnancies? Yes. Number one, because they are not looking forward to this, so the possibility they will be malnourished, it's high. The possibility they will be anemic, It's high. The possibility they're not ready, it's high. Now their pelvic organs are still developing. So they will also be prone to complications during pregnancy, during labor, and afterwards. So in as much as they can become pregnant, they are not ready physiologically. So there are so many complications that can be tailored more for women that are younger, both gynecologically, in obstetrics, and general health. Top on the list is malnutrition, which can directly affect the level of blood, which is anemia, and anemia in pregnancy is also not something we want to happen at all. So the possibility that this young girl will also be exposed to sexually transmitted infection is very high, including HIV. That's a very, very big complications, okay? All right, thank you. If 20s is the time a woman has a higher chance of conception, what can a woman who is not ready to start having kids do? Education, priorities. You have to be ready before you start. Now, if you're already in relationships, because you can't control this, then we have to preach contraception. The only way to prevent pregnancy in young people about this age is what? Contraception. One attempt can lead to pregnancy in girls about this age, because this is when they have very high fertility. So education and teaching them about the implications of actions, because unfortunately, about this age is when they experiment. About this age is when they will fall in love, when they will meet people, they will like people, and they try so many things, which will tell them not to do. They will want to go try it. We all did that. So we need to plug in that gaps. So education and contraceptives. You definitely have to teach them contraceptives. And this is also the age you have to make sure they receive all their vaccinations, including hepatitis, including human papilloma virus vaccine, HPV vaccine. Very, very, very important. So this directly can prevent development of cervical cancer. So we have to make sure we teach them right. And we make sure at this age, they're still, pediatric age. So some of them will still be attached to their pediatric doctor. So you need to make sure you are on them. You have to keep talking to them. It's a daily thing. You have to keep talking about the conversation, because it's very challenging at this age, because they're getting ready to become adults. So there are so many things you need to tell them. Okay, let's continue. Does VVF in teenage girls have future side effects? Definitely, definitely. Remember, VVF stands for vesicovaginal fistula, right? So what's vesicovaginal fistula? Because the pelvic organs are not strong enough and they are not ready. If care is not taken, there will be a communication between the bladder and the material that comes from the anal region. Okay? Now, ordinarily, the bladder, the vagina, and the anal region, they have their different pathways. They are not supposed to communicate. But when these girls are exposed, they have abnormal communication, which is called fistula. So anywhere you see fistula, it's an abnormal communication. So you can have an abnormal communication between the bladder and the vagina, or you can have abnormal communication between the rectum, which is a part of the digestive system, and the vagina. So the one between the rectum and the vagina is called rectovaginal fistula. The one between the bladder and the vagina is called vesicovaginal fistula. So yes, it can complicate their life. You do not want to have a sight of a lady that has VVF or RVF. Very nasty thing to behold. So yes, it can affect them acutely, and it can affect them in the future regarding when they eventually will be ready to start having their family. They will have a lot of stigmatization. They will have a lot of disease and medical conditions that will bedevil them. So the answer is yes, both in the immediate and on the long run. Okay? All right. Correct. Please, when you're asking your questions about sex, try and kind of code it, because for some reason, anytime we mention such word, it's kind of flagged. When is the right time to start educating teenagers about sex and pregnancy? As early as possible. Personally, from 6 up. Tailor that message at 6. Because the possibility that your girl at 6 might get to 7 or 8 and she will start menstruating. So many girls would have started menstruating before age 10. At the point they are menstruating, they can become pregnant. So you have to start the conversation early. You have to start teaching them their various body parts and their functions. So the earlier you start, the better. But the message must be proper. The message you give a 6-year-old girl will not be the message you give a 10-year-old girl or a 15-year-old or a 19-year-old. The messages will be different, but you have to tailor that message and you have to start early. So the earlier you start, the better. Okay? All right. What are some supportive services teenage mothers can benefit from help to them emotionally? We definitely have to support them. They've already made the mistake. They've already taken that decision. So what we need is support, emotional support. We have to love them the right way. We have to make sure we provide A&C services for them. We still have to make sure we provide them with education. So some of them are still very strong. So there are still some teenage girls that can still combine their education with the pregnancy and A&C because some of them are very, very, very strong. So what they need is TLC. So we cannot abandon them no matter what. We cannot abandon our family. We cannot abandon our community. We cannot abandon our girls. Even when they make mistakes, they still remain our kids. They still remain our girls. They still remain our boys. So we must continue. It's a daily effort. We cannot give up on them. So we have to support them spiritually. We have to support them emotionally, which is very important. And we have to support them economically. So if you have a need, if you have such victim, you have to empower that victim so that eventually when they turn into adults, they will have enough to battle this. So we cannot abandon them. There are so many services that should be available to them. So in a community that prioritizes their adolescent health, they will have an adolescent clinic. They will teach them about sexually transmitted infections. They will teach them about contraceptives. They will teach them about, becoming who they want to become. They will teach them about developing their talents. So many of them are so talented. And in this era of social media, there are so many distractions out there. So there are so many things we can teach them. But it has to start from your family. So if you have a girl right now, before 20, start early. Don't assume she's that perfect girl you gave birth to. People change, especially as they get exposed to the macro and the micro environment, especially in this era of social media. You have to make sure you're involved in their everyday activity. You have to make sure you follow up with their education. You have to make sure you follow up with their assignments. You have to go for parent-teachers association meeting. You have to completely be fully integrated because unfortunately, we're in a busy society. The mother is busy, the father is busy, and everybody is busy. And guess what? They will start knowing things by themselves because if you're not careful, guess what? They're going to learn. And you don't want them to learn the wrong things from their peer groups because there are so many of their friends that have already advanced. So who they hang out with are the people they will pick up those stuff from. So this is an area we have to collectively continue our efforts to salvage our kids. They are still kids. We cannot afford to allow kids have kids. We have to curb that particular cycle. Very, very important. Okay? Afternoon, doc. At what age is appropriate to get HPV vaccine? Well, it depends on location. So what I will tell you is this. When next you go for your doctor's visit, ask what's applicable in your location. It can start as early as 9 in some locations. So find what's applicable. But it's something that must be done for both the boys and girls as early as possible. Human papillomavirus vaccine. Find out what's applicable. Find out what the type of vaccines they have available in your own locality. Very important. So follow with your doctor and find out what's applicable to them and make sure you administer that vaccines to them, okay? All right, guys. Keep asking your questions, please. Please keep asking questions. We still have about 7 minutes to communicate, to talk, to interact. So if you have any questions, still feel free and ask, and I provide you instant feedbacks. Remember to subscribe to the community. Remember to share the links with your friends. Encourage them. If you need services, you can get services. Take time and read through. And if you have any problems, we can always be there for you. The lady that mentioned something about subscription, suspended. Where did you see the link? Is it in our Facebook? Is it in our YouTube? So please, you can explain better so we can see what we can do to fix it. Okay? But right now, please keep asking your questions. Keep asking questions. Today, we're talking about teenage pregnancy. Teenage pregnancies in developing countries is a problem globally, but it's more prevalent in developing countries. There are so many things we can do collectively. There are so many things we can do individually. Okay? Please keep asking your questions. We have about 5 more minutes. Keep asking questions. Augusta T. John Sai, can you explain better about the suspended subscription you're talking about? Okay. Are there any side effects on the child? Correct. So when you're pregnant, pretty much everything you do will affect your baby. Okay. So if you're healthy, if you're well, by default, your baby will be well and healthy. Now, remember that at this teenage age is when so many people practice and try out a lot of things. So if a pregnant teenager is still hanging out with her friends, possibility she might be drinking, she might be smoking while pregnant, which is completely unacceptable, can affect her, affect the pregnancy. So the possibility that this lady before 20 will not take good care of herself, take good care of that pregnancy, will affect her and affect the baby. So most girls that will have babies before 20s will have babies that will be malnourished, will have preterm babies, will have low birth weight babies, will have babies that will have complications. So the lifestyle of a mother during pregnancy can directly and indirectly affect the baby. So the answer is yes. Because pregnancy is something you need to be careful with for the 42 weeks of your pregnancy. There are so many things that can go wrong. So in as much as they have better fertility at this age, they are also prone to a couple of complications from the lifestyle. So if a pregnant woman, it's not aware she's not supposed to drink alcohol, she's still drinking alcohol, she's smoking, she's doing all the things she's not supposed to be doing, what will happen to the pregnancy? The pregnancy will be complicated. So the answer is yes. Okay? What tips can you give parents of teenage teens? Love, it's all we need. TLC, tender loving care. You have to accept they've made mistakes. You have to correct the mistake. It's not going to happen overnight, but you have to keep doing the right things, keep using the right message, also keep taking them back to education. Everything is all about education. So in as much as they've made this mistake of becoming pregnant, you still have to support them. Okay? Make sure they attend all the ANC. Help them in the best way you can. So probably provide motherly care, provide services, be ready to also help to look after that baby. Then make sure that child will still focus on education, because education is the key that will unlock a lot of things in the future. So what I will advise the parents is to still, you have to. They are people, they are kids. We have all made mistakes growing up, each and every one of us. Most of the things we know today, nobody taught us. We learned ourselves. Your mother didn't teach you about SES. Did your mother teach you about that? No. So we have to understand that they will make mistakes. But when eventually we are pissed and angry and done with that, we have to go back and support them. Because guess what? If you don't support them, they are going to look for that support elsewhere. So we have to pick them up. We have to reprimand them. We have to correct them in love. They are in a different time now. So we have to keep doing what we have to do the best way we can. Okay? All right. Is it necessary for parents to educate teenage boys? Why not? We are talking about boys and girls. Girls do not get pregnant by themselves. It's still the boys that get them pregnant. Apart from sexual violence, right? Apart from girls that might be raped and abused, and because of doing that, they become pregnant, it's the young boys that engage in sexual practices with them. So yes, we have to teach the boys and girls the same thing. Do you know why? If you are raising boys and you raise very loving, respectable, humble boys, they will grow up to respect women. They will grow up to make sure that when they go into relationships, they respect their girlfriends, they respect their wife, they contribute to the family. But if you are raising broken boys, they will go ahead and keep further making it worse. So yes, The boys are the bigger part of the equation, matter of fact. So yes, you have to also talk to our boys. Boys are more difficult. Okay, you have to. And it's not just left for the mother alone. The fathers should also step up. So many families have left raising of the kids for only the mothers. It doesn't make sense. Both of you started this journey, so both of you must continue. It's a tough job. You know, so many people want to become parents. Let me warn you. Before you sign up the contract of becoming a parent, you have to have patience. That's the biggest thing that will help you, because if you don't, you're going to be done before you start. So it's not just, I want to have a baby, I want to have a, you have to be ready, because your life is not going to be the same. There are days they will piss you off. There are days you will even start worrying yourself. But at the end of the day, this is your responsibility. So make sure you are ready before you ask God to give you babies, because everything is going to change. Okay? All right. Okay, Augusta, what exactly did you subscribe to? Did you subscribe to our community? Did you subscribe to get the special pack? Because there are so many things you can benefit from when you sign up for one-on-one with me. So many things, so many advantages, so many privileges, so many insider, kind of update, and so many incentives. You can't even begin to, think about the things you can get directly from me, especially if you're struggling with your health, with infertility and stuff. When you go to this community, there are specific tailored messages, tailored services you will get from me one-on-one. Okay, so if that's what you subscribe for, then good job. And if you're thinking of doing the same, you can also join them. Is it advisable to place teens on contraceptives in order to avoid unwanted pregnancy? So this is what I will tell you. And I'm going to say this without any, equivocation or whatever bias. They are teenagers. They know what they should do. Now, you have to have your limit. You have to, it's a thin, fine line between actually initiating it. So personally, I will not be the person that will tell you to go and give them contraceptives. No. But they are already exposed. They go to school, they tell them about all this. And if they're in their relationships, look, the point I'm trying to make is this choice. There are so many things they won't tell you. But the question is this. Your duty as a mother, your duty as a father is to ring it into their ear that eventually, when they start going there, they must know about contraceptives. But it's not for you to go and buy contraceptives and start giving them. No, you don't do that. Because somehow it's aiding and abetting. Okay? But you have to make it clear to them like day and night that this is what is this. If you don't want this, then you do this. Okay? All right. I love that question. Very technical, very tough. But we have to start having tough conversations, okay? This is one of the important topics you don't want to miss. So if you have girls, and let me tell you, there are so many of them that are still in their 30s, that are still babies. So the fact you're 40 doesn't make you an adult. You can be 40 and you're a baby. Now, there are some of them that might be below 20 than the adults. They are more mature than people in their 30s, but they are still babies. You still have to do your own part. Okay? All right, thank you. So if we don't have any other questions, okay, it's okay now. You've subscribed. Okay, this is your first time. Okay, so just your normal subscription. Okay, thank you so much. Before you leave the clinic today, make sure you actually subscribe. When you're done subscribing, check your notification to tell you about my time for coming out. So Tuesdays, 6 p.m. Eastern Time, 11 p.m. Nigerian time. Weekends like today, 12 p.m. Eastern Time, 5 p.m. Nigerian time. And we interact for like 30 minutes and we go back and practice. The key word is to practice. You have to practice every single thing you learn from the clinic. Very important, okay? So it's okay to be worried about our kids. But when we are worried, what do we do when we worry? Are we going to dwell in worry? Are we going to dwell in fear and all that? We cannot. Education still remains the biggest tool, the biggest weapon, the biggest factor that can change everything for good. So you have to remind them the reason why they're acquiring education, the reason why they have to be empowered, the reason why they have to be independent, the reason why they have to be fully integrated in themselves, in developing their talents. So it starts with education. We cannot afford not to preach education. And you have to be a good model. You cannot be telling them to do the right things and you're not doing the right things by yourself. No. So if you want the best disciplined kid out there, then you have to lead by example. So you have to be an exemplary mother. You have to be an exemplary father. You have to be well disciplined, because some of them are very manipulative. So you have to. Look, when you take them to school, they are there temporarily. School will not raise your kids. You are the person that will raise them. So when they eventually come back to your home, you have to set the standards in your home so that you can make sure you've done your best. Now, in some situations, you can do everything right, and they can still turn out for bad, but you've done your best. It's only when you're not doing your best you start blaming yourself. But so long as you're a parent and you're doing your best and you're shouting, you're doing the things you need to do, you are okay. It's only when you're not doing it, or when you are applying sentiments, or when you're allowing yourself to be manipulated, to be, for them to use sentiments on you, then you might start blaming yourself. But so long as you're doing your best, don't worry about it. God will take care of that. Okay? All right. Augusta, you don't need to, you're seeing me already, and you said you've subscribed. One moment you say you subscribed, the other moment you say you're confused. Please, can you explain your difficulties so we can see what we can do to help you? Okay, but my time is up. And if we don't have any other questions, then thank you for coming. Remember, tomorrow in Facebook, we have our community clinic, maternal and child health weekend clinic. You don't want to miss tomorrow. What am I talking about tomorrow? I'll remember my topic tomorrow, but every weekend, you don't want to miss my topics. Okay, so show up tomorrow by 12 p.m. Eastern Time in our Facebook community, and you will join me, and we keep learning. But thank you for coming today. I hope I've learned someone to learn about teenage pregnancy. So remember education, remember services to adolescent health, remember the pressure from the society, from the family, from the community to marry early, sexual violence. We can plug in these numbers at this portal. If we can do that, then we are in the right direction to raising our kids exactly the way God intended us to do. Remember, the kids are God's gift to you to look after for a while. You are a custodian. Okay? God bless you and enjoy your weekend. Bye-bye for now.